I'm going to go through the process of therapy and getting professional help and how it's failed for me. It's not meant to put anyone off, it's just something to be aware of, because depending on your situation, depending on what you're going through, depends on whether it will work for you. But for some people, the only advice they can give you and what they think is the best advice is to get medical help. You know, go to your doctor, go to your GP, do this, do that. But it doesn't always help. It's a very difficult situation to be in, and it's easy for your family to then blame you if the situation fails, or to say you're not making the effort. They don't understand why you're not going, or why you've given up, so to say. It's a difficult process, but there are a lot of failings on the side of the medical professionals, but none of them will ever be looked into or admitted. None of them will be taken on board. And there is an actual sort of recognised, named process. It's called the Martha Mitchell effect, where a new person dealing with your case refuses to accept what's happened in terms of a previous failing by a colleague, because that will have a negative effect on their colleague's career. So instead of dealing with the reality of your situation, they find a way to give you a label, a negative assessment, a way to blame you, make it all your fault, and then you go away. And it's just like this process of label, blame, medicate, discard. So it's not the best advice to go to your doctor, but it's the best advice that anyone can think of, because they've never been through the process themselves. That's what I've started to realise. And there's all this sort of promotion to talk to your doctor, talk to someone, reach out to people, this, that, the other, but a lot of it's by people who haven't had that experience, or in their case they had a good experience. But it's not a one-size-fits-all system, and it's so hard for you to put across the process that's going to fit you. They won't question whether the manner in which the package is being delivered to you is inappropriate. All they'll question is whether you are appropriate for therapy. Because it could just be the case that the person who's carrying out your therapy isn't that good, they're not in tune with you, they're not getting anywhere, but there's this need for them to put it on you, and it goes back to this sort of the blame culture that we seem to have. Like, a lot of people you interact with are playing the blame game before you even interact, and it makes it impossible to sort out a 50-50 situation. You know, they're not willing to take any of the blame on them in case they get all of the blame, so what they need to do right from the start is put all the blame on you. And with people like that, you're never ever going to make any progress in terms of actually sorting something out in a logical, rational way. But the only way to sort something out is to find the resolution, find the solution, and the only way you can do that is by talking. But they won't let that happen, because they really can't cope with the talking. And it's a simple process to resolve it and come to a solution. You need to talk, and in the process of talking you need to know why it happened, because once you know why it happened, then you can make sure it doesn't happen again, and then that improves your process. But to find out why it happened, the other party has to accept what happened, and if they won't accept what happened, then they will never answer why it happened. You will never solve the problem or find a resolution. But if they accept what happened, then there's potential for a negative outcome for them, and they're so afraid of the negative outcome for them that they'll do anything they can to deny what happened, and it'll have to be put upon you in some way, and then they just find these ways to label you, and you see that's happening. Well, now you're paranoid, aren't you? You must be, because you're imagining things that aren't happening, and You're telling them you can't trust them because of the way they're behaving like that, and then you were predisposed to mistrust and you didn't trust them before you even got into the situation, and they won't accept that it's their behaviour purely on them that you don't trust them. It has to be something wrong with you, and you just get passed around from person to person, and no one really wants to actually listen or understand your situation. For example, if you're seeing someone at a medical centre of some kind, phone up, ask to talk to someone, and then when they ask your name, refuse to give it. They'll say, well, we can't progress without taking your name. You say, oh, but I really don't want to give my name, and just see how long it goes before they get too frustrated to talk to you. So you see that. You request information from them, and they don't give it to you. You get frustrated, they then try to call it anger, they try and find an emotion and find some way to blame you. But then when you're contacting them, and they need you to answer a question so that they can progress, they've got every right to be frustrated with you. And then you have that same experience with everyone who works on reception. Every time you get a different person, sometimes you get the same person. But it always ends up with them getting frustrated because you won't answer a question, and without the answer to the question, they cannot progress. But then no one can understand it when you, as a patient, ask a question, don't get an answer, get frustrated. It's just this total hypocrisy. Why don't you have that right? When did you sign away your rights to ask a question? When did you sign away your right to have an answer to your question? And at what point did you absolve that medical professional of their responsibility to answer your question? Because you didn't. I've got no contract. I haven't signed anything. And then you just start getting into these stupid situations where they don't need to behave that way. There's no rule, regulation, protocol, procedure, law, anything that says they have to behave that way of not telling you an answer. Well then, they are choosing not to tell you the answer. But they don't want to accept that they're choosing their own behaviour. But there's nothing forcing them to behave in that way, so therefore it must be a choice. And you've got to have a ridiculous conversation to explain in reality. You ask them, show me the protocol and procedure, show me the laws, show me the rules, the regulations, everything that's guiding your actions that says you cannot answer my question. Now you're asking simple questions about their conclusions, their assessments, the process itself, and they just won't tell you. And there's no rule saying that they can't tell you. They just don't want to, and they choose not to. But when you behave like that, you're the problem, and you've got no right to care. Well, you've got no right to access care. You've got every right to care about the situation and how they're behaving, but you've got no right to access care anymore. It's just absolutely stupid. But right from the start, from my very first interactions, like I say, I don't want to just seem like I'm moaning about my particular case. I'm trying to highlight specific ways in which the system fails so that you can understand for yourself when it's failing, or if someone you're caring for is going through the process and it's failing. Maybe you'll have some reference points to look at and say, okay, I understand why that's just failed. You'll have more understanding of what that person's saying back to you about the process that they're stuck in. But from my very first interaction of trying to get some help of going to my GP, it went wrong. Because he didn't want to believe there was anything wrong with me. He wanted to tell me I'm from a caring family, and then when I pointed out that he had seen the signs of abuse, he was aware of the fact I was being abused, but he didn't put two and two together and work it out as abuse or ask questions about abuse. He still wanted to avoid it. He didn't want to accept his role and his part in that process, because it's my parents that were lying. It was me who never spoke up. It was on me somehow that it happened. Nothing to do with him. But then without any proper kind of mental health assessments or anything, I asked for counselling. He put me into CBT, which is cognitive behavioural therapy. And what I've since found out is that, like, from a professional standpoint, that would be totally inappropriate for me. There's no way that was going to work, because it's so rigid and it's goal orientated, and there is no kind of counselling involved. It is just about targets, goals, and how to achieve them. And I wasn't in a position to go through that process. but the first person I went to see just gave me these forms to fill in, like rate yourself from 1 to 10 in terms of feelings and emotions, and I don't exist in terms of emotions. I don't articulate in terms of emotions. I definitely don't put them on a scale of 1 to 10 because I've got nothing to compare it to. It's what can you compare it to if you haven't got some kind of a baseline? But the guy just didn't understand, sat there staring at his computer, wasn't really listening to me. There was no real interaction or connection. It's like I was disturbing him, like the whole time, just sitting there staring at his computer, like I was putting him out in some way, like I was interfering in his personal time. So I went back to the GP and I told him, like, look, this ain't going to work. The guy's just totally detached. I'm not getting anywhere. There's no interconnection. It's like he's not even listening. And he's not asking any kind of questions about me. He's just sort of going through these sort of generic checklists that I have no connection to myself. So the GP said, okay, we'll sort it out, make some adjustments, see what we can do. And he put me back into CBT with another therapist. So, yeah, again, there was no question about whether the therapy was failing, no questions about whether the therapist was wrong. Just assuming that, I'm being a problem or something, so put me back into the same form of therapy I told him isn't working. I told him why it isn't working. If he had been some sort of a mental health professional or made any proper assessments, he would have realised all the problems I was telling him about the therapy meant that the therapy wasn't going to work. There was no way that process was going to work. So anyway, I go to this next therapist. Going into the first session, he gives me them same forms, 1 to 10 scale of measuring your emotions and feelings. I said to him, what is the baseline that I'm measuring myself from? Because I don't understand how to put myself into this form, and he just wouldn't listen. And he said, there is no way of measuring it. There is no scale on which it's measured. There's no official kind of guidelines for what you should be or anything. So just fill it out as you feel. And I said, well, I can't. Like, can we set up some kind of a baseline of what this is, of what a 1 is, of what a 10 is, and then I can place myself on that scale of 1 to 10. And he said, any kind of baseline created by me would be based on my emotions, and if my emotions interject into your therapy, it will corrupt your therapy. Okay, then I can't do it. So there's no baseline on which it's measured. There's no baseline in which you're measuring it. Surely there's no point in doing it anyway, because it doesn't lead to any kind of a measurement of anything, does it? Yeah, he became frustrated with me just for stating logic, refused to help me in any way with it, and we carried on with the session. Anyway, get there for the second session, he pulls out these forms and then just casts them aside and says, oh, you don't do these, do you? I said, well, if you give me some help I might be able to do them. And he just glossed over that and then carried on talking, and the only advice he was giving me was to talk to my friends and family. I kept explaining to him I haven't got friends, I haven't got family to talk to, no one will listen. And it just seemed like such a destructive way to behave, to tell me to carry out a process that's known to fail. Just keep carrying out a process that's going to fail. Go on, keep harming yourself, keep carrying out a process that's going to fail. And he said, well, maybe you should write stuff down. I said, I'll be honest, they don't want the communication, so whether I write it or say it, it's still a communication that they're not going to take on board. And he didn't want to take that on board. Just kept saying, like, you've got to communicate with them, you need to make the effort, putting it all on me. And anyway, I left that second session, I got a pen and paper, and as difficult as it was for me, I started writing the stuff down, writing it down. Went back for the third session. I said, look, I've got a lot of stuff written down. I think you might understand me better, because I realise we're not understanding each other much. If you could just take it and read it for a bit. He said, no, that's not the structure of this session. This isn't how it's going to work. And he kept asking me questions. And I gave him a few answers, but then he's trying to turn it into something else. I was like, no, look, you're not letting me finish. I've got it written down. You can read it if you want. He refused to take it. So then from then, every time he asked me a question, I just pointed at the pad and said, I've got it written down if you want to read it. Sat there in silence, and he'd ask another question. I said, I've got it written down if you want to read it. That's all I kept saying. And about 5 minutes from the end of the session, he'd become more and more enraged all the way through. He was standing over me, dripping with sweat, all red-faced. I could literally see through his shirt. It was so wet. He was just sweating, proper aggressive, in my face, shouting. I looked up and I said, seems like you're getting emotional. You know, if your emotions interject into my therapy, that'll corrupt my therapy. I can't remember who told me that. And his fist went tight. He looked like he wanted to hit me. I could see his temples pulsing, his jaw was clenched in his fist. And he forced himself back into the chair and he sat there. I swear he wanted to hit me. So anyway, the time ticked down with us sitting in silence. I got up, I left. And then the day before my next session, I was seeing him from 5 till 6 because I was working. He phones me up the day before and says, your session time's changed to midday. So I can't make that because I'm working. He said, oh well, if you don't attend, then you've failed therapy. Goodbye. Hung up on me. So anyway, I went back to my GP, told him what had happened, and he told me that none of that had happened. And kept going on about me being paranoid and needing to be medicated because none of that had happened. None of that had happened. He wouldn't have behaved like that. He wouldn't have behaved like that. Just like you told me I wasn't abused as a child. You saw all the evidence of that. You knew that was going on, but you missed that somehow. So now why won't you believe me about this? Why is it that I can't be believed? He kept going on about medication. So, look, right then, as long as I'm still able to work, it doesn't make me drowsy or affect me in any way, I'll take the medication. Right? It can't be sort of anything that makes you drowsy or, just sort of puts you in another world. I can't take anything like that. He's like, no, don't worry about it. It won't be like that. And he ended up prescribing me fluoxetine, which are fluoride tablets. I spoke to someone I knew who worked in a psychiatric unit and asked them about it, and they said, people come in and take a lower dose than that, and they spend the first 2 weeks like zombies. So, and also, if you're prescribed it, you should get a repeat prescription because it isn't something you should sort of start taking and stop taking. So if it doesn't align with your therapy, your personal view of it, and you haven't got a repeat prescription or a repeat appointment, then don't take it because it could actually be more harm than good. So I never bothered taking that, and then I started realising from the outside, it's like I've now got a label of being paranoid, of failing therapy, failing to engage, being problematic, any other labels they want to put on me. I've got a GP who won't listen. I can't get reality across to them. How am I meant to get therapy again? What am I meant to do? How do I wipe the slate clean? How do I get all of that information removed from my records if no one's actually going to listen to me? Then people say to you, why don't you go to your GP? Why don't you go to the doctors? Why don't you get professional help? Really? Don't really work like that, but I've started again now because it's 2011, so I have started again and I'll follow up with some information about that.